My depression's gone, my anxiety is gone. My therapist is like, I don't know what you're doing, but keep doing it.
Do you or someone you know have ADD, ADHD, autism spectrum, or a sensory processing disorder?
Well, today we're here to talk about it in a whole different way. And I guarantee today you're going to hear about these diagnoses and symptoms in a way you have never heard before. So I'm totally excited. Here we go.
My name is Beck Taylor, and I am a mother of two autistic children, and I myself have autism, ADHD, and sensory processing disorders diagnosed.
All three.
All three.
Yeah.
All three.
And
Now,
that's
I can hardly see the person that I came into this program as the woman I see in the mirror today. So many things get affected by this program. It is truly life changing on so many levels. You'll come in for one thing, like I came in for my histamine problems with my mast cell activation syndrome, but everything's changed. My depression's gone, my anxiety is gone. My therapist is like, I don't know what you're doing, but keep doing it. My psychiatrist has taken me off all my psych meds. And this is in just a couple months period. And it is something that requires you. This is not a quick fix, but it is easy if you do what you're told and you really dive in and you work on your blood sugar and you work on the
Yeah.
mindset. It's going to do it for you when you do the work.
Now, you both mentioned mindset.
Mhm.
I have a huge problem with the fact that we actually don't teach people with these symptoms how to think differently. Like, to me, there's already a difference in how they think and process, right? But yet
Mhm.
we don't work to actually change how they think or give them additional skills on how to think about things. What is it like tools to actually be able to shift your focus or hyper focus? And for me, we don't do any, we call it mindset work here, but we don't actually do any mindset work for this population at all. You guys have been through lesson after lesson and had done all the work on mindset. What's one mindset lesson that you did in the program that when you think about it, what if that was taught in schools to
Mm.
your children or to the kids that would totally have impacted how they think and their and results?
The emotional home, I have to say, is definitively the big one for me. I was living in an emotional home that I'll just go in really quickly. It was a battlefield.
Yeah.
And I felt that I was standing in the middle of a battlefield with two armies on either sides, consistently shooting at me all day long. And I had no way to
Mhm.
defend myself. And that was where I lived every day.
Yeah.
And with the emotional home, I was able to imagine myself getting on a bus and driving away from there. And I learned that I could find my happy memories and I could visit them and I could make a new emotional home that was all to myself. And anytime I felt like I was going to go back to that war zone, I got on that bus and I got out of there. And it has changed my life. Such a tiny thing. And this is just a very little portion of this immense program that made such a huge difference to me. And I was super, super glad to be able to share it with my podmates.
it
Mhm.
was very special, Bex.
Thank you.
Jody, do you have anything to add to that?
Yeah, I do. So the ants, the automatic negative thoughts, that was huge for me. It's definitely a work in progress, but that's huge. And then you just piece it all together, and you do the gratitude journal and
Mhm.
um, things of that, and not get 10 steps ahead of yourself with the worry.
That was the big one for me too, Jody. So I understand exactly what you're saying. And you apply these things. And for those of you who are new to this, you don't know what ANTS is, automatic negative thoughts, like she mentioned. Instead of having these automatic negative thoughts, maybe you could change that thought pattern. Instead of going negative immediately, maybe think, okay, let's go to a neutral thought. Let's go to an alternative thought. And
Mhm.
maybe then the outcome won't be negative like the initial thought was. And that has changed my life as well. And these
Mhm.
are these are techniques that we've learned through you, Dr. Maggie. And I know you had to put your own work in to go through your own mindset work to heal yourself. And it has been so beneficial, I know for you, but for so many of us as well.
Mhm.
And one can only imagine how beneficial it would be for somebody who is dealing with these issues that we're talking about today: autism, sensory processing issues, and ADD.
I think there's nothing like someone having had gone through it myself. I consider it a blessing, believe it or not, until I got to the point where I could get grateful for it happening to me. I don't think I could teach it. I mean, I don't think I could have healed myself or teach it, right? And I look at my experience with ADD, ADHD. I look at my experience raising a child with an autism spectrum that, you know, until I did, and I had to go through it, and I'm very solutions oriented no matter what. And I'm blessed that I had the medical doctor. I'm not all, look, guys, I'm not against conventional medicine. I am so grateful I had that training. But then until I started to experience it myself with that experience, and then I added all the training that has to do with like root cause medicine, functional and naturopathic medicine, and added it together, and then saw real benefits and results in my child, in myself, and in everybody else. I realized like there isn't a place like this that exists. Like there isn't a program like this that exists. This is why we brought this up, because I had alumni after alumni saying like, why don't you make it super clear that this program is tailored specifically to be able to address this, whether it's your child or you. And we have parents going through this. We have children going through this. We have teenager and young adults going through this. And so I really feel like this is the whole kit and caboodle that's needed to actually address a problem as complex as this.
A holistic approach. I mean, you talk about the 5 pillars, and it really does take all 5 of the pillars and mindset to address any kind of chronic health issue. But specifically, as we're talking about today, it can be so beneficial for these issues that a lot of them come back to what we talked about at the beginning: focus, the inability to focus.
Difficulty making connections sometimes, hyper focusing, feeling frustrated, disconnected, also feeling like irritable all the time and not knowing why, and just having things bother you or occupy your attention, having tics, having twitches. I mean, these are all parts of this. And yet they're so common, and yet people so feel so alone, and there aren't big solutions for this. And yet it impacts almost all of us in one way or another.
Imagine for a moment if you could make that go away for yourself. Imagine for a moment if you could make that go away for your child. What would that mean to you?
I think we need to challenge what has been traditionally been told to you is there's not that much that can be done about it. You are alone, and there's nothing that much that can be done. I think it's BS. I really do. And I hope we're able to shed light on that. For any of you guys out there that are watching this, if you know somebody, please help me raise awareness. If you can tag somebody that you know in the comment section, that'd be really great. And then if you have any questions, we have additional trainings and resources that we're happy to share with you. But we can't share it with you. We don't know that that's what you need. So if you comment in the comment section, that'd be super helpful. We're also going to drop a link with which you can chat our team. So our team will drop a link right now in chat, and also on top in the copy of this video, there's a link to chat our team if you want more information to learn more.